Communication skills during the exam. Communication is central to nursing and midwifery practice and will always be assessed during the OSCEs. We assess the full range of communication skills, verbal, non-verbal, and written, by observing the interaction between the candidate and a simulated patient. This may be an actor or a nursing mannequin, and also by assessing your nursing or midwifery documentation. The examiner will assess your approach to the simulated patient all through the examination, and they will award marks for communication skills such as clearly explaining care, diagnosis, investigations, and/or treatments, involving the patient in decision making, communicating with relatives and healthcare professionals, seeking and obtaining informed consent, active listening, dealing appropriately with an anxious patient or anxious relatives, giving clear instructions upon discharge, giving advice on lifestyle, health promotion or risk factors, demonstrating compassion and care during communication, clear documentation which meets current NMC guidelines, professional behavior. You should speak to the simulated patient as you would any patient you are meeting for the first time. If you are being assessed using a nursing mannequin, please remember to verbalize your actions and reasons for actions in the same way that you would with a real patient. If you ask the simulated patient a question, the assessor will answer accordingly. A. Approach the patient. Introduce yourself and explain or clarify the purpose of the nursing or midwifery encounter. Check what the patient wants you to call them. Be polite, respectful, non-judgmental, and maintain the patient's dignity. Be empathetic and acknowledge the patient's emotions or concerns and show sensitivity to any discomfort. Be sensitive to personal space. Sit at an appropriate distance from the actor and be aware of their body language. If you move too close and the role player moves back, you are too close. Treat a nursing mannequin as you would a real patient. B. Explaining and advising. Establish what the patient already knows or wants to know. Explain clearly what you are going to do and why so that the patient can understand. Remember to always check if the patient has any questions. Offer appropriate reassurance. Do not alarm the patient, but you must be able to explain the need for urgent action if it is required. Always check the patient has understood. Do not routinely oversimplify names for parts of the body. It is reasonable to expect that most people will know common body names such as bladder, ovary, womb, and vein. If you doubt a patient's understanding, check and alter your approach to meet the patient's individual needs. This is an important skill. Treat a nursing mannequin as you would a real patient. C. Involving patient in management. Respect patient autonomy and help the patient to make a decision based on available information and advice. This includes competent explaining skills as above. Explain information and its applications so that the patient can make an informed choice about any nursing or midwifery actions. Check the patient's understanding and feelings about the proposed nursing or midwifery interventions. They may not always agree with your proposed plan of care. Treat a nursing mannequin as you would a real patient. D. Nursing or midwifery assessment. You should be able to undertake an accurate nursing or midwifery assessment and make a reasoned plan of care if required. Assess the patient's nursing or midwifery problems accurately. Listen attentively to the patient's problems and concerns. Use clear language and question at a comfortable pace. Clarify and check information and summarize understanding. Be able to plan holistic, safe, and effective care based on your nursing or midwifery assessment and best practice.